There were more than 3,000 overdose deaths in New York City last year, and lowering that number is the goal of a program on Staten Island.
So many people, of course, trying to put a cap on this devil of a drug addiction that is opioids. This group's goal, not unique, but the way they want to achieve it is using artificial intelligence to spot trends that could lead to an overdose, and so far, it's working.
Yeah, that's great to hear. Here's Eyewitness News reporter Stefan Kim.
I did whatever I had to do to make money. Like I said, not a lot of people give people chances like me a chance. I haven't always been a model citizen.
There was a time in Joseph Castro's not too distant past when he was unemployed, living day by day, drowning in darkness and negativity. He had no future. He had no hope.
A lot of hustle and grind and just how I was going to get through the next day.
But then someone believed in him and he was able to turn his life around. That someone, the folks at the Hot Spotting the Overdose Epidemic program, the first of its kind using artificial intelligence to reduce non-fatal overdoses. In only its first year, researchers say it led to an 81% drop. The program counted 2 overdose-related deaths in the active group compared to 11 in the non-engaged group.
The overdose crisis is a 5-alarm fire. It's been raging for far too long.
When people fall into the river, we know how to get them out very quickly, effectively. But we have to make sure that people don't fall into the river in the first place.
The initiative is sponsored by the Staten Island Performing Provider System and Northwell Health, the parent company of Staten Island University Hospital. The program merges peer advocacy with AI. The AI is a predictive analytic program that pulls data to identify who is at the highest risk of an overdose. It takes variables like pre-existing conditions, medications, or any history with substance abuse disorder, and social variables like a criminal history or even zip codes. There's more than 100 variables taken into account. This, as the city's health department says, fatal overdoses have climbed to historic highs.
The pharmaceutical industry fueled this crisis. This is blood money. And the money needs to be reinvested in programs that are going to restore people's health.
As for Castro, he has life goals today he says he couldn't have imagined of having before this program.
Then I want to try other stuff. Well, let me see how long I can go with maybe eating some vegetables.